I think we've got to figure out how to redesign primary care, use smart technologies that connect to these humans and to allow them to scale. And I think that's possible with the technology that we have today. And I think that's possible over the next 3 to 5 years to actually make material changes to how primary care is delivered.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we have the Flava of the week about Abbott partnering with Google Health. Can combining ongoing glucose insights with Google Health's technology create a more comprehensive view of personal health? And how can consumers learn to trust the results? I'll talk about that. Then I spent some time with Dr. David Carmouche as he describes his vision for primary care in America, what traditional care is learning from retail, and where consumer obsession, remote patient monitoring, and AI all fit into the equation. I'm Jared Johnson. Let's get it. Flava of the week. Can combining ongoing glucose insights with Google Health's technology create a more comprehensive view of personal health? Let's talk about this for a minute. On August 11th, Abbott announced a first-of-its-kind partnership with Google Health that combines glucose insights from Abbott's Lingo over-the-counter glucose monitor with Google's expertise in AI and consumer technology to help people take a more proactive approach to their health. According to a press release, Lingo users will be able to view glucose trends through the Google Health app alongside other health and wellness metrics in a unified experience, helping them to better understand how daily behaviors influence their overall well-being. Google's Health Coach will use those insights to deliver personalized, contextual recommendations that are designed to help users build sustainable habits related to nutrition, activity, sleep, and recovery. The partnership will focus on 3 areas: connecting glucose data to a more complete picture of health, delivering AI-powered personalized health guidance, and establishing new science about metabolic health by conducting one of the largest real-world health studies to date on the topic. That will combine continuous glucose, wearable, laboratory, and survey data to uncover connections between activity, sleep, well-being, and metabolic health. What's the consumer lens? I like this direction a lot. CGMs have been available over the counter for a couple of years now, but a lot of people who could benefit from trying them out don't use them yet. According to the Cleveland Clinic, they're worn mainly by people with type 1 or type 2 diabetes who need insulin or struggle with blood sugar control. They're also used by pregnant women with gestational diabetes, parents tracking a child's glucose, and occasionally by non-diabetics tracking wellness, close quote. So maybe the adoption among some of those non-diabetics will grow as others experience what I did when I first tried one a year ago. I'm still a novice when it comes to understanding what to do with my health data, but seeing real-time glucose spikes and how they lined up with certain things that I ate was a game changer for me. So bottom line, I don't really see any downside to integrating data into Google's recently upgraded health app, because as far as I'm concerned, the more frequently and accurately we can integrate health data, the better, especially when the consumer is in full control of the experience and the insights that can lead to healthier living. Let's urge consumers to consider new biometrics that are available through CGMs and other devices as they explore how to assemble their own constellation of care. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. Okay, let's get into the flow. Let's get right to it. For several years, one of the themes of the show has been the influence and impact and just the part of the industry that fits inside retail health. And then we talk about health tech, and we talk about scaling, we talk about rural health, we talk about a lot of different things. And somebody who's going to help us connect some of those dots today and give us a great inside scoop, if you will, is Dr. David Carmouche. Many of you know him and respect him. He's a chief medical and commercial officer at Lumeris. And probably some of you know him, from his former days leading some of the efforts at Walmart Health. And we'll see where our conversation takes us today. But very excited. Dr. Carmouche, welcome to the show.
Thanks for having me. Good to be with you.
I've been asking our guests lately rather than give, kind of the CV of, their background, to introduce themselves more of like, what's their philosophy? What's their approach about healthcare? And if they had to boil that down into like what drives them, a couple of core beliefs. I would love to hear how you think about that. What's kind of your core philosophy or belief about healthcare?
What's interesting about that? That's an awesome way to get someone to introduce themselves. And I actually intentionally went through a process with someone a couple of years ago because I was trying to figure out, how do I brand myself? I'm a physician. I spent half of my career taking care of patients directly. I spent the next half in a variety of different business or leadership roles. And so, like, how do you introduce yourself after you've done those things? Like, what are you? And what ultimately came from that exercise was the philosophy. Like, what is the thing that knits all of these experiences together from my perspective? And it's really this kind of relentless pursuit of value. And I'll use value here really kind of in the traditional sense. Like, how do we optimize healthcare outcomes for patients and do it at an affordable and a sustainable price, right? How do we do that? And that requires lots of complex activities across how do you pay for it? How do you design care? How do you deliver that care, et cetera? And wherever I've been playing in that space. And so I'm a guy who early on in my career was faced with the decision to stay in practice or to move into business roles. And I think the best advice I ever got, and it probably is my philosophy going forward, was, hey, David, if you believe that healthcare is inequitable, if it's not delivering optimal outcomes, if it's not sustainable from a cost perspective, if you believe those things, then you can either choose to be part of the problem or part of the solution, but you can't be both. It's mutually exclusive. It's a binary decision. You can either be part of the system and kind of live in that dysfunction and maybe take advantage of that dysfunction, or you can change it. And I've firmly come down on it needs to be changed. Doctors need to play a role in it. And so that's kind of how I've kind of, that's driven my career choices and the roles I've chosen to be involved.
Well, that's a fascinating approach to it too, about how that is a choice and you can't do both.
It's hard. It's hard to do both. I mean, some people say, well, you can't change the system without being in the system. And I agree, but you can choose not to take advantage of the system. And yes, you have to be connected to the system in some way to be able to change it. But I don't think you can exploit the system at the same time that you're materially trying to change it to be better. I think you have to make a choice as to, are you going to you're going to ride the rails of kind of some of the dysfunction for a while and make make money or create value for yourself or for your organization, or are you going to be a disruptor? And I view that in a positive sense. And that's kind of where I've gone in my career, is I've tried to search for solutions to problems. It's one thing, everyone can call out problems in healthcare. It's infinite. I think the harder thing is to bring forward and to work on real solutions to make it better. And hopefully I've contributed in that space. Not everything I've done, and we can talk about Walmart, has been successful. But it's all been in the pursuit of trying to make something better in healthcare in a material way.
Well, I think it's a worthwhile pursuit for sure. I mean, and to be framed that way is important here. Let me drag one piece into that, which is primary care. What's your vision for primary care? Maybe that's a good starting point here in our country, because clearly that's one of the lenses you view things through. I mean, with your practice and things. Yeah, what's your vision there?
Yeah, I mean, I think my experience comes from not only my practice experience, but being the son of two parents who are 85 and 81, and happen to live blessed that they frankly live across the street from me. And my parents would say the best thing of having raised a son who chose medicine was as we get older, we have our own personal concierge, right? I mean, like, they come to me with symptoms, explain this new medication, explain this diagnosis, explain this test they want me to have, explain or tell me what specialist I need to go see. And I think to be able to serve them in that way has been awesome. But it's like, why should you have to have a child who goes into medicine to get that? And so my perspective on primary care largely comes from what I think most of us want, especially as we get older and as our health concerns become maybe more pressing or more complicated, having someone who knows us as humans, who knows us longitudinally, and who can help us make good decisions as we enter, deeper into this kind of morass of healthcare is really valuable to almost everyone. And I think that at the health plan that I was a chief medical officer at, that played out in being able to measure quantifiably that members of our plan who had tight relationships with primary care had 30% lower costs. They maneuvered the system more effectively and more efficiently. They were kind of upstream of some problems where they could be managed without some of the complexity that occurs when you get to them later. So I saw it at the plan. I experienced it in my own practice and how I was able to help people from a primary care perspective. And so, I think primary care is like the linchpin leverage point for a high functioning health system. I think there's so much value gets created in primary care if delivered appropriately and correctly and at a high level, that it just has such a leveraged impact downstream that we should be investing more in primary care, and we should try to assure that all Americans have access to primary care. I firmly believe like that's what we need as step one of our health system.
So what can we realistically accomplish along those lines in some reasonable period of time? I guess that's always the question that gets asked.
The math is against us here, right? Because there's 100 million Americans today in this country, adults, that don't appear to have a regular relationship with primary care. Now, some of that's they choose not to because they're 25 and healthy. But in some cases, in too many cases, it's because there's not a primary care physician available to them in their community in a timely fashion. So number one, there's a big need. There's an unmet need at a time when the demographics of the country are moving us to an older population with more chronic diseases, where the opportunity for primary care is even, and maybe the necessity for primary care is even greater. So people don't have access today. The population that needs that access is aging and developing more chronic diseases. And then finally, the providers historically who've done that are just disappearing. 40% of the folks practicing primary care today are going to retire in the next decade. Lots of estimates that there'll be somewhere between 40 to 60,000 too few primary care physicians for the population's needs in the next decade. Last time I looked, trainees in medical school aren't flocking to family practice and internal medicine. So I think we got a workforce problem and we got a population needs problem. And so, for me, my time at Lumeris for the last 2 years has really been trying to take a different approach to this. Historically, my approach has been change the incentives. And I was able to do that probably most effectively at Blue Cross and at Ochsner. The other was to add human beings to it that maybe didn't have an MD behind their name. Those could be nurse practitioners or PAs or social workers or other humans, but they don't scale very well. They're very expensive and they add to the cost of the model. And they frankly haven't been a solve for the challenge I missed. So my latest opportunities to try to see if we can harness generative AI and use technology to fill in some of those gaps. And we can talk a little bit more about that. But for me, I think it is plausible, and I think a reasonable expectation of the next 5 to 10 years is to take really smart technologies and use it to support the humans who have chosen and signed up to do primary care, to allow those humans to help manage larger populations. So, if we think about panel size, when I was growing up in medicine, it was always quoted, and I didn't know if I should have believed it or not, that like the average primary care doctor takes care of about 2,500 patients. Well, I can tell you today that is not accurate. I mean, I can say with confidence now, most primary care doctors are taking care of far fewer than that. Somewhere between 1,500 patients to maybe 1,800 patients would be kind of what I'm seeing across the country. And largely it's because those patients are needier. They have more things that you need to take care of. You need longer visit times to be able to do that. You've got quality measures that have been thrown on primary care doctors. You've got documentation requirements and risk scores, and all of this stuff has made it harder to be successful at taking care of large numbers of people. And so I think we've got to figure out how to redesign primary care, use smart technologies that connect to these humans, and to allow them to scale. And I think that's possible with the technology that we have today. And I think that's possible over the next 3 to 5 years to actually make material changes to how primary care is delivered.
Is that the direction? Is that the right direction? I guess, smaller patient panels and more
Well,
scale.
no, I think we need larger patient panels, right? I think the problem with smaller, like you could be in a concierge practice, like you could pay $5,000 to get access to a concierge physician who sees 600 patients, and he'll give you his phone number, or she'll give her her phone number. You can have an hour appointment. You can get same day. You can do all the things that you want, and that's awesome for the people who can afford and are willing to pay $5,000 or sign up for that model. But like we all want that model, and most of us can't afford or don't have access to a physician who's available to deliver that kind of care. But with technology, right? With technology and remote monitoring, right? Remote sensors, whether that's Bluetooth enabled devices like blood pressure cuffs or CGM devices for glucose or an Oura ring or an Apple Watch, right? I mean, if you take sensors that can monitor in real time, and smart AI solutions that can help interpret that data and connect it to other healthcare data that's organized around you as an individual, then you can start to imagine a world where there's an always on continuous connection to patients that's technology enabled. And there's a human that is accountable for you and willing to step in. And these systems are alert systems to those humans to say, hey, David's gone off track with his diabetes. You might want to pay attention to that. Or Jared has not filled his prescription in the last 3 months. And as our AI solution is engaged with him, he's got other pressing financial commitments that have taken a priority over his own health. And you, as his clinician, may need to be aware about that. Like that's the world that we're building towards very quickly. And I think that offers the opportunity to deliver care to larger panel sizes per clinician.
Let's add retail health into that equation.
All right,
then.
let's do it.
So because there's an intersection here clearly, and I don't know if it's necessarily a layer that builds on a layer, but it's part of the equation here. What has retail health, and maybe this is directly or indirectly, tied to your time at Walmart or whatever. We can go wherever it makes sense to go. But what has retail health learned about consumers' expectations? Like what has the existing set of offerings, taught us about how people actually want to engage?
Yeah. I think for sure the lens I'm going to apply to this is through the Walmart lens, and whether it's relevant to what happened at Walgreens, what's happening at Amazon, how CVS is approaching Ali, we can explore if it makes sense. But trust trumps convenience today. There's no doubt that you can use retail channels to make healthcare more convenient. At Walmart, we were trying to build credible clinical environments at Walmart supercenters, which were in the community, in the environment. People come to Walmart sometimes twice a week. They come in droves. They're there conducting other parts of their life. Why not deliver healthcare to them? And so from a convenience standpoint, it made all the sense in the world. And there was a belief that people who are busy and live busy lives would want to take advantage of that convenience in addition, they could fill their prescriptions there, they could buy groceries there. Why not get a physical, or why not manage their healthcare or parts of their healthcare at Walmart? And what we found out was that that's not that easy, that people, that the trust required for someone to subject themselves to healthcare is different than than the threshold for trusting that Walmart delivered fair pricing on consumer goods, right? I think Walmart has built trust with their customers that they in aggregate fairly price a broad assortment of goods, and I think they got lots of folks who come to Walmart on a regular basis to take advantage of that. Turns out that it requires something more than that to be willing to walk into a clinic, even a modern looking clinic, and see a physician at a Walmart badge on, take your shirt off and have them be willing to let them put a stethoscope on your chest. That is a different threshold. And I think that where convenience trumps trust is largely the really esoteric kind of low risk stuff in healthcare, right? Hair loss products, acne products, maybe an urgent care visit for an acute febrile illness or something that, the stakes are pretty low and convenience is way more important than trust. I don't need to worry that someone's going to make a bad diagnosis. I don't need to worry that someone's going to harm me. But where the stakes get higher, trust far outpaces convenience. And therefore, I think what's happened is that the promise of most retail approaches have been convenience, to orchestrate, to make healthcare frictionless, to make it easier for people to access care, uh, virtual channels, digital channels, Walmart, supercenter based care delivery channels. And what I'd say is that none of those have crossed the threshold of earning enough trust to get into the more material parts of healthcare that might truly be disruptive and put pressure on health systems and others who kind of are the incumbents in that space. I think that's kind of the key learning that I kind of came out of Walmart.
I think that's very fair, and I think it's really powerful to frame it that way and to understand, because I only hear of trust as a binary thing, like you either have it or you don't, right? I hear it tossed around so much, and it's been discussed in so many different ways related to like AI, what you find out about a healthcare search with AI tools and engines and things. I'm not hearing about different levels of trust, different types, where it comes from. And that's so important to this conversation. So we can build on that and just factor that into the equation is kind of what
So
I'm hearing.
I'd say so that was the learning, and I think it was a limitation of how quickly Walmart was going to be able to move into the kind of care delivery that it saw, which was literally taking care of complex chronic disease, tying its grocery capabilities into the management of diabetes. I mean, there was a lot to think about, like what Walmart could have done or could do to connect pharmacy and grocery and health related consumer products to your clinical needs. Like if we could stitch that together for you, I mean, the opportunity, the theory of it was powerful. We could have done things that no healthcare delivery organization in the country could do by virtue they don't have a grocery. They may or may not have a pharmacy. They didn't sell consumer goods, right? So I think the opportunity was great. It's just that the trust that is required for that is earned over a long period of time, and it's lost like that. So, you build trust through repetitive experiences. It takes a long time, but you can lose trust with one like misstep. And I think the skepticism by which most consumers view an Amazon or a Walmart from a healthcare perspective easily trigger an erosion of trust as soon as there's a misstep. And so I think health systems are, they're the brands for healthcare in most communities. They're given a lot of benefit of the doubt. They make missteps all the time. I mean, I've worked within them. I've lived within them. I've managed within them, and we made lots of mistakes, but we never really lost the trust, writ large of the community. You'd have to do something really egregious at a very visible senior level to lose that level of trust, but not these retailers. That it plays out at a much more kind of finely tuned, precarious kind of state there. The one positive thing that I took out of Walmart that I think should be embraced by health systems and that they should learn from is this notion of customer obsession. So here's the story I like to tell. When my last meeting at Ochsner, my last leadership meeting there was during COVID, during the pandemic. And we brought several thousand people with masks on together to have a leadership meeting. And we would always, one of our values was patients first. I think every healthcare organization somewhere in their values has patient centric, patient first, something like that. And we would start our leadership meetings with a patient story. And this one was a heroic rescue of a 14-year-old girl who had gotten COVID, had a myocarditis from COVID, had a cardiac arrest outside of the hospital, was resuscitated at our community hospital, flown to our main flagship campus in the ICU for 2 weeks, and then walked out on stage with her family, and not a dry eye in the room, and standing ovation. And the CEO says, this is why we exist. We put patients first. This is what we do. We save and change lives every day. Great. Moved to Walmart. I'm in our first U.S. leadership meeting at Walmart, 500 leaders in the room. And they start with a consumer set of stories. But these stories are interviews with consumers who are lamenting inflation, the cost of gasoline, the choice of being able to heat their homes during the winter versus put food on the table or afford their insulin. And then Walmart would say, this is why we exist. We exist to solve those problems for consumers. And I thought about it. I was like, gosh, if healthcare adopted that, we wouldn't just celebrate the heroic acute care save of a 14-year-old, because I think we all agree that if you're really sick in the world, there's no better place to be than in a top-notch hospital in the United States if you're really ill. But when you think about healthcare, for most of us, it's really primary care, preventive care, wellness care. It's like staying healthy as long as we can, being vibrant. If we would design healthcare around the needs of patients, truly, like Walmart does or like an Amazon does, that would make a massive difference. And so I think what I said at the time, I say today, is what healthcare needs to learn from the retail giants of the world is that we exist to solve the needs of our consumers. We don't exist to solve our own needs as a healthcare delivery organization or as a set of physicians, et cetera. And I do think that isn't given enough attention in healthcare. And I hope that at least those 3 years that I experienced at Walmart will bring that perspective with me, at least, and those around me wherever I go in traditional healthcare.
Okay, the last part of the equation here then is the work you're doing at Lumeris here. Like, what problem are you specifically trying to solve there?
Yeah, I mean, so again, it's this access problem to primary care. We do believe that, we've worked in and around primary care for 15 years. We work with health systems historically at Lumeris to kind of help them manage multiple populations that are contracted under a value-based care construct, whether that's full capitation from a Medicare Advantage plan or a MSSP, Medicare fee-for-service kind of value-based contract, or a pay-for-performance commercial contract. We bring technology and services to our partners and help them manage those conditions. And frequently that puts us in and around primary care. So we deeply understand primary care. We understand workflows. We understand what really high quality primary care can do, both from a health outcomes perspective and a economic return. And so we've tried to bring that thinking now into a technology vision of how we can support primary care. And again, partnering with Google and MIT and Wolters Kluwer, UpToDate, great partners to really design an AI operating system for primary care that really we introduce as an always on AI member of the care team deployed through primary care practices to really allow them to engage proactively patients, to autonomously solve problems for those patients, to connect insights back to a human when we need to make a different diagnosis or adjust a medication or think about a new clinical pathway for that patient. Like, that's what we're trying to do. And we've built a lot of capability. I mean, it takes a lot to do that. I said it in 30 seconds. It took 2 years to build the first version of that. We're actively deploying that now at an enterprise level for the first time and getting lots of learnings and refining the product as we go. So that's what we're doing today. And I think, when we're done, hopefully we will have built a credible AI partner to those, champions in primary care who slug it out every day. And hopefully it'll be one that extends their reach, makes them better, takes some of the cognitive load out of primary care, makes time for the human moments that are important to care, and then connects patients and solves for patients outside of an office visit, the things that patients need to be solved from primary care. That's the goal, at least.
Fantastic. Again, I appreciate just painting a picture here, kind of helping us connect some of these dots here. My last question for you, David. I did hear your interview with Blake Madden on Claims Denied on his podcast, which was fantastic. And I highly recommend folks get there because you're able to go into even more depth into that problem that you're trying to solve today, as well as some of those reflections on prior experience at health plans, at provider side, retail side. And Blake, we consider a friend of ours. He's, prior guest on the show and stuff. Anything that didn't make it into his interview that you can leave with us, like just as a parting, I don't know, an anecdote or something?
Yeah, I mean, I think so. Yeah, there's this notion of humanism. So there's a lot of talk in the AI space, right? Of like, are we just trying to replace humans? Like, are humans needed in healthcare? Like, do we want humans in healthcare? And there's this notion of humanism, and maybe medicine being one of the most humanistic professions on the planet. And I've been challenged, right, by some folks who think a lot about the role of humans in healthcare, saying, David, you're building solutions to displace humans. That's not good for healthcare. It's really interesting, though, when you think about the definition of humanism, it's really around delivering personalized, high quality care that kind of considers the whole person. And if you think about what AI can do, it's super empathetic, probably more empathetic than humans. It has infinite capacity to analyze data and match it against the evidence and allow clinicians to deliver world-class diagnosis and treatments to every patient. And so for me, I view the use of AI, if done correctly, as supportive of a humanistic experience for people, regardless of whether or not a human is delivering it or not. Every step of the way, I don't think they're mutually exclusive. And so I didn't get a chance to get into that with Blake. You and I were kind of in a little bit of that discussion as we were thinking about Walmart. So I think that's the one thing I'd say. I don't think it's AI or human. I think it's AI serving some of the roles that, frankly, humans have either failed to deliver or don't have time to deliver, and then making time for a human to connect with their patients when it really matters the most, a bad diagnosis, a bad prognosis, or reassurance. And I think today we've lost some of that in healthcare, and I hope AI, if done correctly, can restore a bit of that while meeting the humanistic needs and expectations of patients.
All right, well, maybe this conversation can help reframe that conversation for people and that discussion in the industry. Let's hope for that. David, all the best to you and everything you have going on, and thanks for everything you're doing.
And thanks for what you're doing too. Thanks for having me.